Hi everyone, so my name is Midwife Sally. I've been getting this question a lot of times. Mom asking me, I lost my baby, what caused it? What caused it? And sometimes it's very overwhelming because sometimes if you are not there, you cannot speak. Okay, so it is the doctor or the midwife who can really tell you what happened at birth. And yes, sorry for the loss. Yes, so today I want to go straight into it. What are some of the reasons why a baby could lose a life at birth? Okay, prolonged labor. If you stay in labor for a long time, maybe 3 days, 4 days, you are still in labor. Okay, if they do not do anything about it, it can cost the life of the baby. Okay, yes, so prolonged labor, once your labor is delaying, they have to act fast, take the next step, cooperate with your doctor, cooperate with your midwife. Sometimes there's bleeding at birth. You are in labor and all of a sudden you have placenta abruption. Placenta abruption, what is happening is that the placenta is detaching first instead of the baby coming out first. So this bleeding can cause reduced blood supply to the baby, because you know it's the placenta that is giving the baby all the oxygen. Okay, and so once the placenta detaches first and the mother starts bleeding, oxygen supply to the baby is cut off, and then the baby can go into distress, and if they are not fast, the unfortunate can happen and the mother will lose the baby. Okay, so we have cord around neck. Okay, sometimes the cord around neck is also a problem, especially when it ties the baby's neck for, let's say, some can be really tight. There are some that are loose, but those that are really tight, if it is vaginal delivery and it is not detected early, blood supply to the baby can be cut off, and it can also cause lack of oxygen, and this can affect the baby. The baby comes and the baby is already blue, lack of oxygen, and it can cause the baby to lose the life. So this is one of the issues as well. Yes, then we can talk about meconium stained liquor. So anytime there is meconium, let's say meconium is the green soot the baby passes when it is in utero. It's not supposed to be in the baby's in the water around the baby, and so anytime it is in the baby's water, it means that the baby is lacking oxygen, getting into distress. Okay, depending on the severity, if the baby starts, if intervention is not taken and the baby starts swallowing it, because something meconium aspiration syndrome, meaning the baby is taking it in, go through the nose and all that in utero, and that can cause the baby to have reduced supply of oxygen, and can also cause the baby to lose the life. So anytime you see greenish meconium, please go to the hospital as soon as possible. Then we have gestational diabetes. Gestational diabetes is one thing that has to be managed so well, especially when you're about to give birth. Okay, the baby sugar can just go off, and then if intervention is not taken care of, like you are not being monitored properly for your sugar whilst you are in labor, and then yes, you are not being monitored properly, baby's sugar can just go off, and then by the time you realize the baby is not there. And so if you are gestational diabetes, you have to give birth on time. Work with your doctor, work with your midwife. Okay, very important, because if you do not do that, it can affect the baby. I have personally seen a lot of people with gestational diabetes go, by the time they realize there's no fetal heart. And so please be very mindful. I'm very passionate about this. Okay, be very mindful, work with your doctor. In labor, they should be checking your sugar. Okay, then we can talk about lack of techniques. Okay, so if the person who is doing your delivery does not really have the skill, if you're not careful, it can also cause a little problem. So always make sure that wherever you're going to give birth, it is a good hospital. You trust the doctors, you trust the midwife, that they will do the right thing for you. Okay, because bad delivery techniques can also maybe cause the life of your baby. Okay, then we have unexplained causes. We don't know what happened. The baby was fine, the baby just stopped breathing, condition changed, baby became blue, and then at the end of the day you realize that baby was not breathing again, no heartbeat. It also happens, unexplained. Okay, then we have delayed second stage. Okay, so now you are in the labor, your cervix is fully dilated, push, baby is not coming. Mother, they are encouraging you, push, baby is not coming, and you are so delaying. It can cause all these problems. Please, if you are asked to push as much as you can. Work with your doctor, work with your midwife, because delayed second stage, if you are not careful, blood supply to your baby, oxygen supply to your baby can be cut off, especially when the baby is just here and it stays there for a long time. Okay, so please make sure that you cooperate with your doctor, with your midwives. Sometimes babies are born with certain abnormalities that is not compatible with life. They may go through the pregnancy, but immediately the baby is born, the baby gives up. I've seen one before. The baby came without brain. Okay, the baby came without brain, and the head was without brain and all that. I mean, within a short while, like very few minutes, baby was born. So that is one. Then we have so delayed congenital abnormalities. It can be just anything, all these abnormalities that can happen at to newborns. Then we have complications of, let's say, jaundice. We have severe forms of jaundice, especially those that are present at birth. If it is not well managed, it can cause the baby neonatal death and all those things. So please, if you give birth and the baby's eye is yellowish, send the baby to the hospital as soon as possible. Or even if you see it at the hospital, let them see it immediately. If you give birth and the baby's color is blue, you see that the baby's color is not pink, it's blue. It's like, that is a sign of lack of oxygen. Let them investigate before you take that baby home. Baby cannot breastfeed, don't take the baby home. Baby has not passed urine. I think all those things should be done. In my hospital, they check some of these things before the baby goes home. Pass meconium, pass urine, make sure everything is fine before you take the baby home. Then sometimes when babies are born premature, you know, the higher the gestational weeks, the higher the baby's chances of survival. And so if the baby is born, let's say 27, 26, the baby's chances of survival is to some extent less than a baby who was born at 39 weeks, because 39 weeks is old. Okay, so prematurity is one of the contributing factors. Make sure that if you are giving birth to a premature baby, the baby is at a hospital, get the services they need, like a NICU, all those things. Premature babies survive, let me add that, they survive, but with good care. Delay in sending them for to get all the care that they need can cause a neonatal death. Okay, then we also have things like delay to seek care by the mother. Labor has started and you want to be at home forever until you are 10 cm. What if you are having high BP? What if you are having a problem? Like, how would they detect it fast? But if you report quite early, they can take your blood sample. They have time to really investigate the whole labor before the real actions come. Okay, so as much as possible, don't delay too much before you go to the hospital. So delaying too much at home before seeking care can also be a reason, because some complications may be missed. Okay, and if you go to the hospital, please talk to your doctor, talk to your midwives about your risk. I remember there was a mother who had a risk of she has given birth not long through CS, and she gave birth again. She didn't tell the doctor that this is what happened to me, so the doctor also took it a bit lightly. Okay, I don't know, they did not see, because it was an emergency. She came when emergency, labor. By the time they realized, she had ruptured her uterus and she lost the baby. Okay, so please, if you have any medical condition, any past history, talk about it, because all this can cause neonatal death. Then infection, if you have severe infections, certain infections, talk to your doctor about it. Okay, so these are basically some of the things that can cause you to have neonatal deaths. A lot of moms come to my inbox asking me, midwife Sally, what happened? It is only your doctor, your midwife, or the person who is there that can tell you exactly what happened. Then you can plan. Anytime you have a neonatal death, don't give up. Always know that God is in control. Another baby is going to come. The fact that you had a bad history doesn't mean that it is going to repeat itself. Things can be better. Get a pregnancy class, get a midwife, see a gynae, do some lifestyle changes, check how you choose your hospitals. All these things can help. And one thing I would say about all the conditions that I have mentioned, they are all preventable. None of them is like something that you cannot help it, apart from the one that is unexplained. Okay, but most neonatal deaths are preventable with the right doctors, nurses, and everybody, and your own participation. And ultimately, God, everything is going to be fine. My name is Midwife Sally. Thank you. If you like this, share it. Let somebody also follow as well. Bye.